The first common kitchen accident is the cuts and laceration. Cuts and laceration are the types of wound where the skin is torn, cut, or punctured. So the causes of cuts and laceration are handling a broken glass, improper knife handling, incorrect cutting techniques, and sharp edges on can. To avoid this, always slice away from yourself to prevent accidental injury. Store knives properly. Wear cut-resistant gloves. To first aid, clean it with soap and water. Use antibacterial ointment, wrap with bandage or gauze. The second one is the burns. Burn is an injury to the skin or organic tissues primarily caused by heat or due to radiation, radioactivity, electricity, frictions, or contact with chemicals. The causes of burns is hot burners in stove top. The second one is the oven. And the third one is the hot dishes. To avoid burns, always use pot holders. Turn the pan handle toward the center of the stove. Turn stove and oven off when done. First aid, we have the different types of burns. We have the first degree burn, second degree burn, and the third degree burn. On first degree burn it is the top layer of your skin. It looks red and painful like sunburns. On first degree burn, apply antibiotic ointment, remove clothes or jewelry that near the burn. If your clothes are stuck, don't remove them. Second degree burn it is a deeper skin injury. It turns red, blisters, swells, and hurt. On second degree burn is soak the burn area in a cool water for 15 minutes to 30 minutes. Apply antibiotic cream to prevent infections. Cover the area sterile dressing and change it every day for signs of infection. The third degree burn is worse and need a medical emergency. Cover the wound with a cool wet dressing and call 911.
Causes: worm cords on appliances, undergrounded outlet, water and contact with appliances. Precaution: replace worm cords. Disconnect small appliance when not in use. Disconnect appliance in falls in water. Use outlet covers. First aid: disconnect the power source first. Remove the injured person from the power source. Administer CPR. Call for help. Treat burns. Number 4. First aid for slip, trips, and falls. Causes: splatter and spills on the floor, climbing and chairs and countertops, and loose clothing shoelace. Precautions: keep floor clean, wipe up pills immediately, use step-toe to reach high places, and wear fitted clothing. First aid: make sure you're not hurt before standing up. Slowly raise your hand and knees, and try to crawl on a chair and pull yourself up. If you can't get up in your own, tell for help.
First, there are some causes of choking which can cause by eating too fast and not chewing food well, or eating with denture that do not fit well. And to avoid this kind of situation, avoid small, sticky, or hard foods that are hard to chew and swallow. And while eating, just sit down to eat and drink a water. In addition, there are some examples of first aid for choking. First, place one hand in a clenched fist between their belly button and the bottom of their chest. With your other hand, grabs your fist and pull sharply inwards and upwards up to 5 times. Second is eye injury. There are some common types of eye injury, which is scratches and abrasion, which is from fingernails or tree branches or small pieces of grit wood, or metal getting in the eye. And to avoid this kind of situation, by wearing goggles or safety glasses when playing sports or working with hand tools. Moreover, there are some examples to first aid for eye injury, which is gently apply cool compress to relieve pain and swelling, and avoid using frozen food bags to prevent bacterial eye infection.
The last one is the poisoning. Poisoning is injury or death due to swallowing, inhaling, touching, or injecting various drugs, chemicals, venom, or gases. The cause of poisoning in kitchen is cleaning agents and kitchen chemicals. To avoid this, always keep cleaning supplies separate and use safety locks on cabinet drawers. First aid for poisoning. Call poison control and tell them what the substance was inhaled or indigest, and follow their instructions.